Digestion isn't something we think about much, but when something goes wrong, problems show up quickly. At a basic level, most GI issues fall into three categories: irritation, obstruction, or inflammation, and each one creates a different type of problem. Some problems come from irritation of the lining. In GERD, stomach acid moves up into the esophagus. This leads to that classic burning feeling, especially after eating or when lying down. With ulcers, the acid isn't just in the wrong place, it's actually damaging the tissue. And there's a key difference here. Duodenal ulcers tend to feel better after eating, and gastric ulcers usually get worse after eating. So, timing with food actually helps you tell them apart. Many ulcers are caused by H. pylori infection or long term NSAID use. Treatment often includes antibiotics and medications that reduce acid. Other problems come from blockage. In appendicitis, the appendix becomes blocked and inflamed. Pain often starts vague, then moves to the right lower abdomen. And one important detail: if the pain suddenly gets better, that can actually be a bad sign. It may mean rupture. Because of that, patients are usually kept NPO, and heat is avoided since it can increase the risk of rupture. With bowel obstruction, something is preventing movement through the intestines. So you'll see things like abdominal distension, vomiting, and one key distinction: if the bowel is trying to push through a blockage, sounds are loud. If nothing is moving at all, it becomes silent. In more severe cases, obstruction can lead to complications like perforation, which is a medical emergency. Some problems come from inflammation and enzyme activity. In pancreatitis, digestive enzymes activate too early, so instead of breaking down food, they start damaging the pancreas itself. This leads to severe abdominal pain, often radiating to the back. Common causes include gallstones and alcohol use, and the main treatment principle is simple: rest the pancreas. That's why patients are kept NPO. So, to look at a quick overview of all this, most of this stuff follows patterns: irritation from acid, and blockage causing pressure, or inflammation causing damage. Different causes, but all disrupting normal GI functions. So, to look at all this together: acid irritation, burning pain, often worse with position or food; ulcers, pay attention to timing with meals; obstruction, pressure builds, causing distension and vomiting; no movement, silent bowel sounds; pancreatitis is inflammation, so the goal is to rest the pancreas. Once we see the pattern, the conditions become easier to identify. Let's run through a few quick practice questions. Burning chest discomfort after eating and lying down. What are you thinking? GERD. Epigastric pain that improves after eating. What does that suggest? Duodenal ulcer. Right lower abdominal pain with sudden relief. What is the concern? Possible rupture from appendicitis. Abdominal distension with vomiting and high-pitched bowel sounds. What does that indicate? Mechanical bowel obstruction. Severe abdominal pain radiating to the back with elevated lipase. What is it? Pancreatitis.